Hi, my name is Lauren Greco. Today I'm going to be talking to you about improving safety in healthcare. What is the definition of safety? Safety minimizes risk of harm to patients and providers through both system effectiveness and individual performance. What is the clinical issue? We need to increase safety among all healthcare professionals in order to decrease medication and staff-made errors to our patients. With the advances of technology today, we need to work together to help improve communication between all members of the team and to help decrease medication-related errors. A medication error is defined by any preventable event that may cause or lead inappropriate medication use or patient harm while the medication is in the hands of a healthcare provider. Next, I'm going to be talking about why this issue is important. The topic of safety in the healthcare world is one that should be held to the highest priority level. Safety can refer to the safety of our healthcare providers, safety of our patients, reducing and eliminating medication errors, reducing treatment errors, and even our nurse-to-patient ratios. In order for our patients to be provided the best care possible and have good outcomes, safety is what needs to be established first and foremost. Approximately 1 of every 131 outpatient deaths and 1 of every 853 inpatient deaths results from medication errors. Administration errors account for 26 to 32% of all total medication errors, and nurses are the ones who mostly administer the medications. Next, we are going to be discussing types of medication errors that occur. Administration of the incorrect medication, such as the wrong drug, strength, or formula. Distributing the wrong dosage of medication to a patient. Giving a medication to the wrong patient. Prescription transcribed incorrectly by the physicians, such as them having illegible handwriting. Knowledge-based errors, such as giving an example of a medication prior to checking the patient's allergies. Action-based errors, physicians being interrupted while writing an order and they write the wrong drug name or the wrong drug dose. Administering a correct medication through the wrong route. Say if a patient has dysphagia and you give them a medication by mouth. Next, we are going to talk about how technology helps eliminate medication errors and patient care errors and improves the quality of care to our patients. Computerized electronic records have improved the care of our patients and their outcomes. Electronic medication records allows clinicians to see a larger number of patients through better access to comprehensive patient histories that include clinical data, which can help physicians spend less time searching for results and reports. Some advantages to electronic health records are medication alert errors, laboratory result availability, remote access to patient charts, and reminders for preventive care. Electronic health records improve communication between physicians and patients by having them use patient portals, which helps engage the patient to manage their own care more efficiently. Advances in technology and computerized charting systems have improved the ability of certain diseases to be diagnosed, prevent patient care errors from being made, and improve patient care outcomes. The use of barcode scanning of patients' armband to confirm identity can help reduce medication errors in regards to patient information. Next, I'm going to be discussing some organizational barriers. The biggest barrier is budget cuts. Hospitals not wanting to spend their money to fix broken equipment or to buy more mobile computer carts for medication administration. In doing some research, I found an example in an article on a study that was done in California in 2013. It showed that there was not enough mobile medication carts for isolation rooms. This was stated because once a cart was in an isolation room, it would have to stay there until the patient was discharged or until it was properly sanitized which was very time-consuming. It was found in the study that the patients in which medication errors were being made were in fact isolation patients, where nurses were not able to scan medication in the room due to lack of equipment. More computers were purchased, and every room had a scanning computer assigned to it, so the results showed the following year medications were reduced by 5%. Another organizational barrier is no extra money for continuing education classes within a facility. Having physicians enter patient orders electronically through computer programs instead of handwritten orders will help eliminate some of the errors being made. Physician order entry reduces errors by identifying and alerting physicians to patient allergies or drug interactions and giving decision support regarding standardized closing regimens. Research and studies have shown that nurses in hospitals who mandate the 5 rights of medication administration be in effect have a lower incidence of medication errors occurring each year. Computerized charting systems allow physicians to have remote access to their patients, so if an emergent situation does come up, they can log in from anywhere and read the lab or radiology report and order an intervention if needed. Having good open communication skills helps to decrease patient errors made. Having everyone chart electronically about their patients during the day helps build a more team approach to the level of care and allows everyone to be on the same page when caring for a particular patient, which in turn leads to less mistakes being made. Next, we're going to focus on the impact of safety on nursing. Having more technological advances will help decrease the risk of safety errors being made. Nurses today are less likely to make a medication error due to new barcode scanning mechanisms put into place in the hospitals. Nurses need to learn to be less distracted during a medication pass and to only work on one patient's medications at a time, which will help cut down the risk of errors being made. It is a well-known fact that most hospitals do not have safe patient-to-nurse ratios, which causes burnout and potential safety errors to be made that would harm the nurse and the patient. Hopefully in the future this will improve and all states will be mandated to abide by safe patient-to-nurse ratios. Nurses in some states are being taught in school and having refresher courses while working in the field using simulations related to certain patient scenarios, which will help to increase positive patient outcomes. In another study that was done in a Florida hospital over the past 5 years has cut down their emergent casualty rates by 50% since they initiated a new simulation program by implementing into their hospital that is mandatory for all employees to take part in. After the simulation is over, it is for them to discuss their options, which could have been done, and talk about the major teaching points to this scenario. One way we can help decrease medication errors is by setting up committees within our hospitals to analyze when errors did occur, why did they happen, and what strategies we could have come up with to stop the error from occurring. Working together as a team, nurses, prescribers, and pharmacists have improved patient safety by applying appropriate technologies. We now appreciate electronic medical records and electronic charting system as tools that help us achieve greater efficiency and state-of-the-art caring. Next, we're going to talk about how we could share this information with the public to improve patient safety. We could publish this slideshow to our hospital's website. We could have a staff meeting which includes a slideshow presentation, and then have an open discussion about the issues related and answer any questions that people may have. We can post key facts in our hospital's monthly paper. We can also make up cheat sheet guides and post them around the hospital on all the different bulletin boards. Next, we are going to talk about the essentials of the BS education. So the essential that I chose, the concept is basic organizational and system leadership for quality care and patient safety. It's essentials number 2. It is defined as safety in healthcare is the minimization of risk of harm to patients and providers through both system effectiveness and individual performance. The QSIN competency number 5, which is the one that relates to this topic, is also the concept of safety, and it's defined by a very similar definition stating it minimizes the risk of harm to patients and providers through both system effectiveness and individual performance. Next, we are going to go into the conclusion. So research demonstrated that nurses, more than any other healthcare professional, are able to recognize, interpret, evaluate, and correct healthcare errors. The baccalaureate graduate implements safety principles and works with others on the interprofessional healthcare team to create a safe, caring environment for care delivery. As technology continues to advance, nurses need to be continually educated on medical changes being made in order to ensure that safety and the safety of patients they are caring for. New computerized medication systems have helped decrease errors made since they have been implemented into the hospital. Heavier patient loads can increase a nurse's risk of making a medication error. Having a two-step check system of the 5 rates of medications, along with a computer scanning method, will help decrease chances of medication errors. Research and studies have shown that nurses in hospitals who mandate the 5 rates of medication administration be in effect have a lower incidence of medication errors occurring each year. Computerized charting helps improve team communication and allows for safer and more quality of care for our patients. And these are all the references that I used in doing my presentation.